This is Dr. Noll of Noll Psychological Group. Today we're going to talk about bipolar disorder. We want you to know that we have a bipolar screening that's available on our website. It's bipolarinventory.com, but we'll talk more about that later. Bipolar disorder is a mood disturbance that involves both highs in terms of manic episodes and depressive episodes. It can be a very disruptive illness and accounts for a fair degree of the evaluations that I end up seeing in hospital settings. This is a mood disorder, not just changeable mood. There are people that have unstable emotions and that can vary in terms of their mood from one minute to the next in a quite intense fashion. This is not what's meant by a bipolar disorder. Even though there are variations in mood in bipolar disorder, at least in bipolar 1 disorder, these variations in mood are longer lasting. There are conditions that involve strong reactions to stressors, most notably different types of personality disorders, borderline personality disorder, histrionic personality disorder, but these are not a bipolar disorder. A bipolar disorder does not involve strong reactions to psychosocial stressors. This is actually a cyclical mood disorder, and the cycle of moods involve both depressive issues and mania. So to have a bipolar disorder, one has to have at least one episode of mania. The manic episodes are defined as a period of a few days, a week, maybe even longer, during which an individual is highly energized. They are moving fast, they're thinking fast, they have excessive energy, they have a reduced need for sleep. They also have fluctuations in self-image, such that an individual might be grandiose in terms of their self-appraisal. Things that would be daunting to a person normally don't seem to be that daunting to an individual in the midst of mania. In addition, individuals with manic episodes can also have psychosis. They can be very, very agitated as well. So sometimes a great deal of frustration and agitation accompanies a manic episode. So there are hallmark symptoms that are associated with bipolarity. Some of these symptoms involve cognitive changes. For example, during manic episodes, individuals can be quite tangential and can be disorganized in terms of thinking. They also tend to talk very rapidly. They have a pressure that's involved in their speech, and they can talk quite excessively. In addition, there are depressive symptoms that are a part of bipolar disorder, and often it's the depressive symptoms that are the more dominant feature. Whereas an individual might have occasional manic episodes, the depressive features are often there for a longer period of time. Sometimes individuals seem to have manic episodes such that it almost appears that they use up all of their energy, and at the end of that they fall into a depressed state. Now, there is a variation of bipolar disorder which does not involve full-blown manic episodes. This is a bipolar 2 disorder. This is characterized by depressive features and hypomania, where mood is elevated and one's personal pace is increased, but it doesn't quite reach the level of mania. There isn't this sort of intense change in terms of the acceleration that an individual might experience. Bipolar disorder is often looked at or evaluated in terms of interview, but also testing with the MMPI, the Minnesota Multiphasic Personality Inventory, can be very helpful in this regard. There is a full-scale measure of mania that is part of the MMPI, and that scale can be broken down into various subscales that measure elements that contribute to bipolarity. There are also scales that measure hypomanic activation and subtle versus obvious symptoms of mania. The MMPI tends to do a very good job of sorting out presence or absence of a bipolar disorder. At Noll Psychological Group, we've also developed a measure that we call the BiPod, which is the bipolar inventory for determination of presence of the disorder. It's a 75-question true and false test that does a good job of also sorting out presence or absence of bipolar disorder. You can actually take the BiPod for free at bipolarinventory.com, or if you visit our website, nollpsychgroup.com, there is a link to the BiPod. Fortunately, bipolar disorder tends to be a very treatable disorder. Bipolar disorder tends to respond very well to mood-stabilizing medications such as lithium or Depakote. Also, when an individual is being treated for bipolar disorder, it's a good idea for them also to be involved in psychotherapy for several reasons. One is that the bipolar disorder tends to be a very disruptive influence in an individual's life, and there are often many issues that one needs to work out, and psychotherapy is a good way to do that. Also, if one looks at research on outcomes for bipolar patients tend to be better if they are involved in a combination of psychotherapy and medication treatments. Thanks for watching our review of bipolar disorder, and look in again on our channel for more information about different types of psychiatric issues, their diagnosis, and their treatment. And remember to subscribe to our channel. We're going to be posting videos from time to time that should be very interested to individuals that have an interest in mental health treatment and psychology.